It's Mari McInerney here with Lisa, one of the keynote speakers here at the conference. Lisa, would you be able to introduce yourself, please?
Kia ora. Nō te atanga maha ki ngā puhi Ngāti Mani o Poto Oku Iwi, no Papaioea Aho, ko Lisa Te Paiho tuku ingoa. So kia ora, I'm Lisa, and I've just told you my 3 iwi or nations that I belong to, as well as the town that I'm from in Palmerston North, New Zealand.
Thank you very much. Now, and in what capacity are you here at the conference?
I've actually come to the conference in 2 capacities. So I'm a radiation therapist and I'm co-chair for MiRO, which is Māori and Radiation Oncology. But I also currently am the National Program Manager for Breast Screen Aotearoa. So I've come in both of those capacities.
We've just come out of a session on mammography where you talked about breast screening for Maori women, that rates are not as high as they should be, and the reasons why and some of the things you're doing to address that. Can you talk to those issues?
Yeah, I can. Yeah, so in New Zealand we have consistently really had at least a 10% equity gap, so difference in participation for Māori compared to non-Māori. In some areas actually that equity gap is quite small, and that is down to very strong community support for the program, strong partnership with the community and funding the community. So important to fund the community. In areas where we aren't doing so well, it tends to be where women have to travel quite a long way to the breast screening service. We haven't actually partnered with the community well in those areas, and so women don't have the support that they require to access our services, which are often not actually accessible to Indigenous women. So it is a focus of mine. I've been in my role for about 1 year, and so I've brought my focus on improving Māori cancer outcomes to breast screening, and we are truly partnering with Māori and funding new ways of working with women holistically. So we've actually got to focus not just on screening but that whole person. Because we know that people bring all sorts of things with them when they come and see us, and it's important that we're trying to meet them, and I think reciprocity is really important, so that we are, yes, you've come to do your screen, now what could we help you with in the rest of your life or your family's life as well. So really important concepts for me.
And could you perhaps give some examples of how you went about doing that, but also the feedback that you got? What women were particularly welcoming or not wanting?
Yeah, I mean the feedback from women, so many women don't actually know what's involved with a mammogram. So when they arrive they can be very surprised that they actually have to take their clothes off and somebody's actually going to touch their breasts. So that not knowing that can be such a shock that the person actually doesn't come back again. And so we need to be much better with our education in a culturally responsive way. We've also in the past had complaints about the way the service runs around the service, so that it's not patient or family centred. So we're trying really hard to open up the times for our appointments. I've tried really hard to encourage walk-ins where possible. And yeah, to meet the woman where the woman is, rather than just saying you need to come along and do whatever we're doing at the moment. Yeah.
Always the issue, isn't it, in healthcare?
Definitely.
Now, you also gave a really interesting presentation with a colleague on Friday, which I won't be able to pronounce properly. Can you say what you were talking about?
Yeah. So on Friday, I was there as co-chair of MiRO, Māori and Radiation Oncology, and I was with my other co-chair, Jermaine Fraser. So we were talking about tino rangatiratanga in action. And so we talked about that being weaving authentic leadership. And so what we are meaning is it's that true partnership with between Māori and other national organisations in cancer to make a difference in cancer outcomes for Māori. So we work with universities and students right through to working with our national bodies that oversee the strategy for like cancer action plans in New Zealand.
And can you give some examples of where you hope to be making change that way?
We definitely want to make a change with the cultural responsiveness of our staff, so that's why we've chosen to work with a university. One is to increase the number of Māori students that they have, and actually they've got the most students that they've ever had in our course in the whole time it's been going. So that's really positive. And also we've introduced what we call a tuakana teina mentoring program. So all our Māori students are mentored in the clinic by a senior radiation therapist who may be in another clinic, because we actually do have a lack of Māori radiation therapists at the moment. But the students find that really valuable. It's a chance to talk about their clinical practice, but also what it means to be someone who is Māori working in that clinical setting.
The Treaty of Waitangi has been a key part of a lot of health advocacy and policy work in recent years. We don't have treaty in Australia, although it's coming to Victoria. Can you say what role it plays and the importance of it in terms of healthcare for Maori people?
Yeah. So Te Tiriti o Waitangi is our founding document. It's what gives us the right to know that we can be Māori, live as Māori, and expect to have Māori leadership and expect to be at the decision-making table as well. For me and my personal practice, I've always tried to implement the 4 articles of Te Tiriti, and now I'm doing that across breast screening as well. So it's quite hard for us probably to implement that Māori leadership. I'm lucky, I'm pleased I'm Māori, and I'm in my role, and my manager and my director are all Māori as well. So there's a change happening, which is great. But I think the ones that we can work on really well is partnership. So true, authentic partnership with other Māori leaders and organisations. Equity, so we definitely have a focus on equity and on being confident to put the resources where they're needed, so that we're targeting areas of need. And also wairuatanga is another article, so that's about the spiritual side. So both for our women, that we're meeting their needs, but also for ourselves, that we're meeting the needs of staff in terms of their spiritual well-being, which some people find hard to think about if they're not religious, but it really is your values and your beliefs feel honoured and respected, and you're in an environment that's uplifting and you feel looked after. Yeah, so I try to do that in everything I do, and we're definitely doing that across the program.
Fantastic. Now, any calls to action for people who are non-Maori, non-Indigenous? What can they do, specifically speaking about the medical radiation science professionals here, what can they do to provide culturally safe care? What do they need to learn?
Yeah. I think one of the things is to know that being culturally safe or responsive to the people that we're looking after is the responsibility of everybody. There aren't enough Māori or Indigenous people in medical sciences, medical imaging or radiation therapy, and so we really, really rely on our allies. Our allies are super important, and sometimes they can do and say things that we can't as Indigenous people. So number one, it is up to you. It's up to everybody to do something. So in my talk I talked about you do need to know yourself. You need to know your values, your beliefs and your biases. And then you need to also learn about your community and learn about them in a positive way. So there's a lot of negative information out there about different groups and how participation rates aren't as good or cancer outcomes. What you need to do is go and find out what the strengths of that community are, and then work with those strengths and work with those people to try and make a difference. And everybody is actually able to do that. Even if you're not in a leadership role, you can do it every day in the interactions that you're having with the person who comes to see you.
Have you got an example of something that was really good, that you really saw somebody change their thinking?
I actually have found that when I've given people data, because sometimes people don't actually know that there are inequities in healthcare, so when you can show the evidence that yes, we're not doing so well, And then when they actually can listen to a person, so somebody's story. I had some quotes today in my presentation, but we do also have hui or meetings where we invite the community to talk about what their experiences are like. I've seen people move to tears when they've heard about what it's been like for someone to access healthcare and how they've felt. And I think that those are the impactful things that can make people see that what you think is normal and comfortable is very not normal and uncomfortable for someone else. And if you can try and put yourself in that other person's shoes, then I think you will do a better job at caring for them. Personal stories are really powerful.
Thank you. Is there anything else you'd like to say or takeaways from this conference?
I've actually really enjoyed the conference, and I enjoyed the session we just had now. I sometimes feel like I know about Aboriginal and Torres Strait Islander people, but the last talk that I saw had photos about the woman's journey to breast screening. It was actually really enlightening that we have similarities with Indigenous people in New Zealand and Australia, but we have huge differences as well. I really enjoyed just seeing a little snippet of what life is like for another Indigenous community.
Thank you very much.